let me get it.
Carol, who lives with her assistant's dog, has mental and physical health conditions which affect her daily life.
I have times when I can't get out of bed, and I have times when, to anybody on the street, I'd look perfectly well.
Good girl.
She's able to work from home, but relies on personal independence payments and says the assessments are already rigorous.
It's so traumatic and so stressful, and the constant reassessment just exacerbates people's symptoms, especially if they've got mental health problems. You know, if you're depressed or anxious and you're living on edge like that all the time, it's awful.
Rishi Sunak says these benefits need reform and suggested some people with mental health conditions could receive treatment instead of payments.
We need to be more ambitious about helping people back to work, and more honest about the risk of over-medicalising the everyday challenges and worries of life.
He said mental illness is real and serious, but the bill is rising.
We now spend £69 billion on benefits for people of working age with a disability or health condition. That's more than our entire schools budget, more than our transport budget.
2.8 million working age people are not in a job due to long-term sickness. That compares with 2 million in 2019. He's also concerned about sick notes, with 11 million issued by GPs last year. Knowsley in Liverpool has the highest rate of what's called economic inactivity. People not in a job or seeking one, including because of illness. People here were concerned about the proposed changes.
There's no compassion whatsoever in that statement.
If you haven't been through it, then you don't understand it. If you haven't been through the depression where you physically can't get yourself out of bed in the morning.
People want to work, people don't want to sit on the backside.
Charities say these reforms would have a significant impact.
This feels like a full-on assault on disabled people, and it feels like we're trying to split out mental health from physical disability, and it's really worrying, and I think probably deeply distressing for lots of people to hear our Prime Minister say that their condition isn't as serious as they think it is, and doesn't deserve the support that they've been getting in the past.
Hi. Good morning, Mr. Prime Minister.
After the speech, meeting workers, the Prime Minister says his welfare plans are a moral mission. The finer details will have to wait until after the election. Tamara Cohen, Sky News.